Welcome to Delta State. Based in Nigeria's South-South region, this ever-evolving state has been able to transform itself through the focused leadership of its state government. While tackling many infrastructural and development challenges, the Delta State government has also paid particular attention to developing its healthcare sector.
At inception, when Delta State was created, we found that we inherited a number of hospitals that pre-existed, and over time, we've increased on that number. We had something about 40 hospitals. Right now, we have about 64 hospitals. Okay, and we have a lot fewer health centers, but right now we have over 440 health centers. And that's been an increase in terms of available health facilities. And then we've also been very mindful about the spatial and equitable distribution prior to the creation of Delta State. So a number of riverine communities never really had hospitals or health units. The capital was in Benin, and attitudes were, the major towns in some of these other areas. But with creation of states, the government was closer to the people, and then the government now established health units in very remote areas, difficult to reach terrains, in the riverine, as well as in the hinterland, in the land areas. So there's been some distribution of health facilities. Of course, along with that are also a number of routes has been made to reach these facilities for movement of people, goods, and materials.
Delta State has implemented 3 free-of-charge healthcare programs in a bid to make sure that adequate medical services are available to all its citizens. The first of these was the Rural Healthcare Scheme. Introduced in 2005, it entails government-sponsored medical practitioners traveling to the most remote regions of the state, providing free healthcare. This was followed by the Free Maternal Healthcare Program, which was introduced in 2007. The success of which has led to the state developing its final free program, the Under 5s Medical Care Program. Dr. Faith Ejegi has worked at Central Hospital Warri for almost 10 years as a consultant ophthalmologist before taking over as the hospital's medical director and overseeing the implementation of the free healthcare programs.
Now, the free maternal, we see the patients Monday to Sunday, 24 hours every day, 7 days a week, and 30 to 31 days a month. So we are busy with the free maternal patients. And it's not just around us here. Those who come here, they come from outside. For instance, now a woman goes out to deliver, and maybe it's with a traditional birth attendant or a private hospital in town. All of a sudden, you find that if you cannot deliver on her own and they need to do a surgery, the best place to rush to is Central Hospital Warri. So we are always busy, both night and day, in the free maternal program. The same thing goes for the free under 5. Everything. And the problem we're having here is that most of the time, they rush these patients when they are almost dying to us because it's free. And by the time a woman wants to do a cesarean session outside, and they are charging you about 100 and something thousand. Why would you want to pay that when there's a free program? So they rush them here. So we are really having a lot of work in our hands. But luckily, there is a maternal MCC center that is ongoing, they are building. So maybe that will help to expand the facility to be able to accommodate the increased number of patients we are having. The same thing, the free under 5. You find little babies that are delivered elsewhere, they can't cope, they have to rush them here because they need, this is where we have incubators to be able to keep them alive. And then in keeping them alive too, talking about facilities and the things we need here, we need lights all the time because the babies in the incubators, the light has to be on 24 hours. They can't cope even a few minutes outside it. And so they rush them from outside and they will have to accept, and everything is free. Every one of them that come here is free. If they have to rush a child like that to a private hospital where they have to pay for an incubator, you know how much that will cost. So they all rush here because it is free.
Mrs. Ojem is just one of the many Deltans benefiting from the state's free healthcare projects. Having been cared for during and after her pregnancy under the free maternal health care program, she's also been able to receive the state's aid in caring for her now 18-month-old daughter, who was badly scalded by hot water.
Ever since we came that Saturday, we met the doctor. They took care of her. Ever since then, as you can see now that the thing is healing speedily. We came here on Saturday in the afternoon, around after 12, with the help of the doctor and the nurses in the ward, so that the child is improving. And she's even playing, she's eating. For us to go, that is just the only thing left now. We are under this program, 5 years, children under 5 years, there's a program. I think we are enjoying the benefits. The one they don't have in the hospital, we'll buy outside.